So we're going to go over how to drop medication and get an accurate amount in your syringe, how to drop oral medication, suspensions, elixirs, etc. So we have our medication bottle. In our case, in lab, oftentimes what we'll get you to do is pour the medication into a plastic med cup and draw it out of there. You're going to use an oral syringe when the amount of oral suspension you need to give is 10 mLs or less, so that you can get that specific volume or accurate volume. You can free pour or straight pour into a med cup if it's more than 10 and visible on here. So say it's 20 mLs or 15 mLs, you can use the markings on that cup and then you can get at eye level and do it that way. But 10 or less, we're going to use the oral syringe. So I'm just also going to show how we're going to show it in this video. And again, most of what we practice in lab is you actually draw it up out of that med cup and then remove your bubbles, etc. and waste the excess or return the excess depending. But what you might see in some facilities, and it's kind of just good to see, is that the containers actually come with devices such as this inside them, and they then fit oral syringe ends really nicely in there. So you can just stick it in there, flip your bottle upside down, and draw up, say we wanted 5 mLs, you can knock the bubbles out of there, and you can get your 5 mLs that way. So it's kind of neat, and you might see that in certain areas, something like that just stays in there. Or you might see it's a same idea, just a different sort of look or version, but the oral syringe will stick in there when it's in the bottle. So we'll go over now how to draw up. So say we want 5 mLs. We want to find that 5 mL volume marking. Get familiar with your oral syringe as well. You want to know every syringe is calibrated a little bit differently, so you want to make sure you look at the calibration and what it's going up by in terms of its measurements. This one goes up by 0.2 for each small dot in between the whole numbers. So we're going to draw up a little bit excess of 5, a little bit in excess of 5, so I'll just turn it around there so you can see. So we'll just go a little bit past 6, for example, and that's just to then account for any bubbles that we're going to be getting out. Just so you know, when we do get that whole 5 mLs, it needs to be full to the tip, just like this, to be considered that correct amount. So what I'm going to do now might seem a little bit strange, but I'm going to hold my syringe straight up and down, and I'm going to pull back so that we have just air at the top. And that's going to allow any bubbles that are at the bottom. And you especially want to check out around that plunger area. That's where bubbles tend to linger. It's going to give them space to move up. Whereas if we keep that syringe full, we're not really giving the bubbles anywhere to go. So at this point, I like you to recap your syringe. That's mostly just for cleanliness purposes, because when you start flicking, it can kind of spray everywhere if it's not recapped. So using the heavier part of a pen, generally, which usually is the side with the cap on it, we're going to actually whack really hard, harder than you might think, right on that bubble. So that takes a little bit of practice of getting used to that dexterity of where to hit. You will also see people hit on the table, the side of the table. Either is fine. What doesn't tend to work and is really tempting and maybe seen in other areas is that gentle, consistent tapping. It's either going to take hours or sometimes even create more bubbles. So you actually want to give it a really hard whack. And I don't know if you could see, there was a bubble sort of along the plunger there, but a really solid whack got rid of it. So we now don't have any bubbles along our plunger or within the barrel of our syringe, except obviously this big air space at the top. So now we're going to take our cap off. Sometimes you see a little bit of medication collect there in the tip. Before you push up, I would actually say pull back on the plunger just to get everything back in the barrel. Now you're going to push up, And I'm holding the syringe at 90 degrees, not only so you can see it in the video, but that's an important thing to note, that when you're standing at the med station, not to hold it on any sort of an angle, because when you go to refill it, if you're holding it on an angle, it will not fill evenly. You'll get bubbles around those top corners or edges there. So when you're recalibrating or refilling your syringe, once you've got rid of the bubbles, hold it straight up and down and fill the entire syringe. You might have to do that kind of a couple of times. Make sure you fill the entire syringe. And then you can tip it down like this and calibrate to, say, that 5 mLs that you wanted. And now you're full to the top and you have 5 mLs, and make sure you're reading it correctly at that top line of the plunger is at the 5 mL marking. You can recap it. Just be cautious if you do recap. Sometimes it pushes the fluid down a little bit, so when you go to take it off, of course, there we go. You might think, oh, I maybe don't have 5 mLs now. So you could recap it just by putting it on very lightly. So you can take a paper med cup and just place it over the top, so it's protected when you're taking it to the patient's bedside, when it's on your tray or in your cubby, etc. So just like that is okay. So that's how to draw medication in an oral syringe. And you'll want to practice a couple times with that just to get really handy and proficient at it.